Michaela?
Yeah.
Hey there, I'm Chelsea from Radiology. I'm going to be taking 5 different x-rays of you today.
Okay.
Can you just verify your name and date of birth for me?
It's Michaela Clevenger, 9/10/94.
Okay. And it looks like we are taking pictures of your lower back, so can you tell me what brings you in today?
Yeah, I just missed a step and I fell and hit my lower back on a step and slid down about 2 more.
Oh, okay. Well, can you rate your pain on a scale of 1 to 10 for me?
Probably a 9.
A 9, okay. And how would you describe your pain?
It's just like an achy pain.
Achy pain, okay. Does anything make it better or worse?
Ibuprofen makes it feel a lot better.
Okay. And is there any chance you could be pregnant?
No.
Okay. When was your last menstrual cycle?
Last week.
Okay. So what I'm going to have you do is put on a gown for me.
Okay.
You will, if you have elastic or any writing on your underwear, if you're going to take that off, take your pants off. If you have a belly button ring, take that out. And go ahead and remove your shirt.
Okay.
For this video, we're going to keep her in a black outfit so you can see the crosshairs from the light field. But you would normally have your patient change into a gown. But for this video, we're going to go ahead and keep her in black so you can see the light and the crosshairs. Okay, Michaela, if I can have you come lay down on your back for me and just watch your head. Okay, and for an AP L spine, we are going to use a 14x17 cassette. So here's a 14x17, and we're going to put it in the bucky tray lengthwise. We're going to use an SID of 40. So you want to make sure that your tube is on bucky, and I've got it set to 40 inches, but I've got to raise her up. There we go. Okay. So what I'm going to do is bring this down where I need it. Or about where I think I would need it. And I'm going to line the bucky tray up with it. Here we go. And I'm going to go ahead and put my marker on there. And you're going to move your marker in a little bit because you are doing a spine. And then what I'm going to do is just make sure she's real nice and straight on the table. That's good there. And then I'm going to center it to her body, right where the spine is. What I'm going to do is feel for her iliac crest, and that's right here. It's right here on this side. And you're going to center 1.5 inches above that. So that's about 3 of my fingers. I'm going to move it up. Right about there. And that looks pretty good. And we've got our marker on it, and then you could even come in just a little bit more. So about right there. And that looks pretty good for our AP. For an AP lumbar spine, it is 90 kVp at 20 max. The structures that you will see on an AP spine is the lower thoracic vertebrae to the sacrum, symmetric vertebrae with spinous processes centered to the bodies, sacroiliac joints equidistant from the vertebral column. You don't have to shield for this projection, but what I will have her do is blow your breath out, hold it out, take the exposure, and you can breathe. And next I'm going to do an upshot, and that is the Ferguson method of the L spine. Okay, so for our upshot, you can use an 8x10 or a 10x12 cassette. And we will use an 8x10. I'm going to go ahead and mark it. For this, you are going to do a 30-degree angle cephalic. You keep a 40-inch SID. The technique that is used is a 90 kVp at 28 mass. Be sure and not turn the light on until you get it to where about you think you're going to be. That way you don't blind your patient. I'm going to collimate down to about an 8 by 10. You could even come down a little bit more. And what you're going to do for this shot is you're going to center it 1.5 inches above the pubic symphysis. So here's her pubic symphysis, and 1.5 inches is about 3 fingers for me. So I'm right there. And I want to make sure that my buggy tray is lined up. So I move that. And then I've got it marked. And for her respiration, I'm just going to have her hold her breath. So hold your breath. I'll take the image and you can breathe. So there's another good view of that. And what you'll see on that is the lumbosacral joint and a symmetric image of both sacroiliac joints free of superimposition. And next, after the upshot, I'm going to move on to the lateral, or excuse me, not lateral, the obliques of the lumbar spine, and there's 2 of those. Okay, so now for the obliques, we are going to switch our cassette back to a 14 by 17 lengthwise. The technique that will be used is 90 kVp at 36 mass, and we keep our 40-inch SID. I've got a sponge here that we'll lay her back on when we get ready to roll her over. Before I do anything, I'm going to move this tube up and get everything aligned. So I just have to move her body. Go right over here. I'm going to have the patient reach across her body and bend this knee. I'm going to have her roll all together. I'm going to place this sponge right here and have her roll back. There we go. And place this arm on the sponge. Straighten this leg out. Once again, we are going to center 1.5 inches above the crest. So that's about 3 fingers for me. So about right there. And then 2 inches medial to the ASIS. So here's her ASIS. I'll go 2 inches in. Open up my collimation. And I'm going to use my right marker. Because you're seeing what's closest to the IR, which is her right side. And a way to check yourself is to go back here and feel up her spine and imagine your fingers coming out the other side. So that's about where I'm at. Another way to check is to have the patient put her head straight up and make sure her nose is lined with those crosshairs, and it is. So that's perfect. We'll have her move this arm out a little bit. Blow your breath out. Hold it out. Don't breathe, don't move. Take the exposure if you can breathe. And we've got her body also at a 45-degree angle here. And what you'll see on both obliques that we're going to do is an oblique projection of the lumbar or lumbosacral spine. It shows the articular processes of the side closest to the IR. When the body is in the 45-degree position, the lumbar spine is what is being radiographed, and the articular processes and zygohypophyseal joints are shown. So next we're going to do the other oblique. So I'll come around here. And let's see, let's have you roll up. There you go. Remove the sponge and roll back. I'll come over here. Again, 40-inch SID. Same technique, 90 kVp at 36 mass. I'm going to have her reach over, bend this knee up. Before I have her roll, I'm going to go ahead and switch out my marker. We're going to do the left marker because we're looking at the side closest, and that's going to be the left side. So I will have her roll up, grab my sponge, place it back here, have her roll back, move this on here, place this leg down straight, and you shouldn't have to move much other than medially. So again, 1.5 inches above her iliac crest, find her ASIS, and go 4 inches medial. Put my hand back here and feel her spine. And we're about there, maybe over just a smidge more. Pretty good. We'll even go down just a hair. Come up here and with her head straight, and that her nose is perfectly aligned with those crosshairs. Just make sure everything's still lined up. It is. Blow your breath out. Take the exposure and you can breathe. Now I'll have her put her arm up here, bend this leg, roll up, and she's going to roll all the way on to her side. And now we're going to prepare for a lateral projection of the spine. Okay, so now we're going to do a lateral lumbar spine. And I've got her rolled up onto her left side. And what I'm going to do is just bring her shoulders back. Perfect. And make sure that she is perfectly lateral. You can go down here and make sure her shoulder and her hips lined up, and it is. And you can also check by making sure that she's lying directly on that greater trochanter. And for the lateral lumbar spine, we move back to a 14 by 17 lengthwise to set. There we go. I'm going to go ahead and mark it with my left marker because she's left side down. It's a 40-inch SID. The technique used is 96 kVp at 56 mass. So, centering is 1.5 inches above the iliac crest, so we'll feel for those. And there we go. And then for the lateral, on the lateral you're going to go about 2 inches back from the ASIS. So here's her ASIS, and you want to go about 2 inches back from that. So we're about right there. And you just want to make sure that you've got some light field here in the back. Make sure everything's lined up here. I've got my marker down. I've got light. Let's see. Everything looks good. She's nice and lateral. I'll have her blow her breath out. Hold it out. Take the exposure and you can breathe. And the structures that are shown on a lateral lumbar spine is a lateral projection, of course, of the lumbar. You can see the crest of the ilia closely superimposing each other, soft tissue and bony trabecular detail, and lumbosacral intervertebral disc space. And next I'm going to do an L5-S1 spot, and this will be our last projection that we do on her. Okay, so right before we move on to the L5-S1 spot, for the lateral that we just did, you also see the intervertebral foramina of L1 to 4. The L5 intervertebral foramina are not usually well seen in this projection because of their oblique direction. And the vertebrae are aligned down the middle of the image. Superimpose posterior margins of each vertebral body. And the spinous processes are in profile on the lateral lumbar spine. So now we'll move on to the lateral projection. It's the L5-S1 spot. And for this projection, You have the patient stay just like they are, and we are going to place that central ray 2 inches posterior to the ASIS. So here's that. And it's going to be 1.5 inches inferior to her iliac crest. So we'll go here. And 1.5 inches below, it's going to be right where my pointer finger is, so I use 3 fingers. And then go 2 inches back from her ASIS. And I'm right about there. And a way to test yourself with this is you can go right here. You feel with your thumb and your middle finger. Place your pointer finger right down the center. And just make sure, just go to the first knuckle there. And it should be right in the center there, depending on how long your finger is. And that's how you know you're right on that spot. For this, I'll still use my left marker, but I can change the 14x17 out to an 8x10. Go ahead and do that and mark it with my left marker because she's upside down. And then the technique that is used on this is 96 kVp at 100 mass. And the structure shown on this is the lumbosacral joint in the center of the exposure area, the lumbosacral intervertebral disc space, and the crest of the ilia closely superimposing each other. Also soft tissue and bony trabecular detail. And on this projection, we will also have her suspend respiration, so hold your breath, expose, and you can breathe. And that is all for the lumbar spine.